Hello everyone, this is Dr. Madhusudan Rao and the program I teach medical students. Today's my topic is acid-base disturbance. In this particular class, I'm going to touch briefly on the various aspects of acid-base disturbance. Before we go into the topic, let us know the various acid-base disturbances and the terminology that is used and their meanings. By and large, acid-base disturbances include metabolic alkalosis, metabolic acidosis, respiratory alkalosis, and respiratory acidosis. Sometimes there could be mixed forms. Alkalosis. What is alkalosis? Alkalosis is elevated pH of the arterial blood. It could be metabolic or respiratory. Metabolic alkalosis is primarily due to elevation of serum bicarbonate. It's the result of several mechanisms which we are going to touch in the course of time. Metabolic alkalosis is the most common acid-base disturbances. Respiratory alkalosis is due to dysfunction of the respiratory control center with the expulsion of more amount of carbon dioxide. Then what is alkalosis? Elevated pH of the arterial blood is defined as alkalosis. What is the characteristic feature of metabolic alkalosis? It is associated with primarily elevated serum bicarbonate. What are the electrolyte disturbances associated with metabolic alkalosis? It is associated with hypokalemia and hypocalcemia. Electrolyte disturbances are going to complicate the metabolic alkalosis. What is the name of the equation? It denotes relationship between hydrogen ion, PCO2 and bicarbonate. This is Henderson-Hasselbalch equation. pH, PCO2, bicarbonate. Arterial pH is elevated in metabolic alkalosis. Okay, it is normal or lowered in respiratory acidosis. Elevated bicarbonate and PCO2 occurs in both these conditions. That means in metabolic alkalosis, there is elevated serum bicarbonate. PCO2 is elevated in respiratory acidosis. Okay. Hydrogen ion concentration, serum bicarbonate levels, and PCO2, the relationship is described in Henderson-Hasselbalch equation. pH is inversely related to the hydrogen ion concentration. What is alkalemia? What is acidemia? What is alkalosis? And what is acidosis? The meaning of these terms should be understood clearly. Alkalemia is a condition wherein pH of the blood is less than 7.45. Acidemia is a condition wherein pH of the arterial blood is less than 7.35. It means elevated pH is described as alkalemia, lowered pH is described as acidemia. Then what is alkalosis? It is the pathological process that results in alkalemia. Okay. The same way, acidosis is the pathological process that results in acidemia. Okay. If you look at the pH, normal pH ranges between 7.35 to 7.45. If the pH is less than 7.35, it is acidemia, or commonly called as acidosis. And if the pH is more than 7.45, it is alkalemia, but generally described as alkalosis. What is the normal serum concentration of hydrogen ion? It is very low in health. When the pH is 7.4, it is around 40 millimoles per liter. Then what are the determinants of primary acid-base disturbance? They are PCO2 and bicarbonate. PCO2 is related to the respiratory alkalosis and respiratory acidosis. And bicarbonate is related to the metabolic acidosis and metabolic alkalosis. And what is metabolic alkalosis? Metabolic alkalosis is the condition wherein serum bicarbonate is above 26 milliequivalents per liter. What is metabolic acidosis? When serum bicarbonate level is less than 22 milliequivalents per liter. That means metabolic acidosis and the metabolic alkalosis is related to serum bicarbonate levels. Then what is respiratory alkalosis? Respiratory alkalosis is a condition wherein partial pressure of carbon dioxide is less than 35 mmHg. Then respiratory acidosis is the condition wherein partial pressure of carbon dioxide is more than 45 mmHg. That means PCO2 is related to the respiratory acidosis and respiratory alkalosis. So what is the most common GI cause of hypovolemic metabolic alkalosis? It is persistent vomiting. About this we are going to talk in detail in the coming class. What are the effects of excessive vomiting on acid-base balance? So when there is excessive vomiting, there is loss of hydrogen ion, number one. Along with that, there is a loss of chloride because gastric juice is rich in hydrochloric acid. So there is loss of hydrogen ions as well as loss of chloride. This results in the retention of bicarbonate. When there is excessive loss of hydrogen ions, it results in retention of bicarbonate. The hydrogen ion is secreted into the gastric juice from the parietal cells, and the bicarbonate is retained in the cells. So when there is excessive vomiting, there is volume depletion. Okay. Elevated serum bicarbonate results in alkalosis. This is the process that initiates metabolic alkalosis. With the loss of hydrogen ions, with the retention of bicarbonate, with the elevation of the serum bicarbonate, process starts initiating the metabolic alkalosis. That means metabolic alkalosis pathophysiology is described in two phases. And phase of initiation, phase of maintenance. With the loss of hydrogen ions in the vomiting, and with the retention of bicarbonate, with the elevation of serum bicarbonate levels, with the depletion of the blood volume, the process starts initiating the metabolic alkalosis. Okay, you please understand this point. Then what is the physiological response to drop in extracellular fluid? When the extracellular fluid volume is depleted, what are the physiological changes? So, the extraglomerular apparatus of the nephrons, they will sense the volume depletion in the system and trigger the renin-angiotensin aldosterone activity. Okay, this results in loss of potassium and retention of sodium and bicarbonate. Okay. Vasopressin response causing the peripheral vasoconstriction. Cortisol response is an adaptive mechanism, and there is rise in serum glucose levels. How the respiratory system responds to metabolic alkalosis? By hypoventilation and elevation of PCO2, but it is limited by the degree of hypoxia. What is the physiological response of kidney for hypovolemic metabolic alkalosis? Kidney responds with, as I told you, renin-angiotensin aldosterone mechanism is triggered that results in the retention of sodium and chloride for the replenishment of the volume, and at the same time there is a lot of loss of potassium. There is increased absorption of bicarbonate in the proximal pulmonary tubule. Because of the volume depletion, there is a decreased glomerular filtration rate. There is a decreased filtered bicarbonate and the activation of renin-angiotensin axis, which again results in the loss of potassium and retention of sodium. So this is the renal compensation that initiates the metabolic alkalosis. What are the effects of hypokalemia? Hypokalemia is the situation wherein serum potassium levels are low. When the serum potassium levels falls down to less than 2 milliequivalents per liter, there is movement of the potassium from the intracellular space into the extracellular space across the concentration gradient. There is intracellular shift of hydrogen ions in order to maintain the electroneutrality. Okay. There is secretion of hydrogen ions in the distal tubule with retention of the bicarbonate. Okay. This process is in the phase of maintenance of metabolic alkalosis. Okay. There is extracellular movement of potassium across the concentration gradient. There is shift of hydrogen ions from the extracellular space into the intracellular space against the to maintain the electrical neutrality. Then there is secretion of hydrogen ions into the distal convoluted tubules because there is hypokalemia and the hydrogen ions secreted into the distal convoluted tubule with the absorption of bicarbonate. Okay, this is called paradoxical aciduria. This occurs in the situation of hypokalemia. Okay, this is the process is described under the maintenance phase of metabolic alkalosis. A word about hydrogen ion in the extracellular fluid. Hydrogen ion balance is maintained between input and output. Okay. At normal pH, the normal pH is between 7.35 to 7.45. Hydrogen ion concentration is inversely related to the pH. Okay. But acute severe change in pH is fatal, which is a result of gross changes in the hydrogen ion concentration. At pH of 7.4, okay, the hydrogen ion concentration in the plasma is around 40 nanomoles per liter. Hydrogen ions are very reactive combine with the protein molecules and alter the functions of the cellular activity. So, for example, it can destroy the cell membrane of the myocardial cells and cause the cardiac toxicity. Concentration of hydrogen is very low in plasma at normal pH. A minimal change in the hydrogen ion concentration can result in change in pH. But the presence of buffer system attenuates the degree of change in the pH, even in the presence of acid or alkali that is added to the fluids. Okay? Lungs, kidney, intracellular and extracellular buffer systems play a role in the regulation of acid-base disturbance. Okay? Lungs and kidney. Lungs play an important role in the excretion of volatile acids. Kidney plays an important role in the excretion of non-volatile acids, that is secretion of hydrogen ions and absorption of bicarbonate. Intracellular and extracellular buffer systems play an important role, that is bicarbonate as an extracellular buffer system and phosphates as an intracellular buffer system play an important role in the acid-base regulation. Well, hydrogen ion levels in plasma is a major determinant of pH along with PCO2 and bicarbonate. Okay. Then about a brief note on the hydrogen ion pathway. Hydrogen ions are regularly produced in the body due to metabolic activity. It is a protein metabolism that results in excess production of hydrogen ions into the extracellular compartment. That is the reason why we restrict protein intake in the patients with chronic renal injury. Well, incomplete carbohydrate metabolism results in lactic acidosis. Incomplete fat metabolism results in the production of acetones, acetoacetic acid, and ketones, butyrate acid. Hydrogen ions are also generated by intestinal loss of bicarbonate. Okay. But it is balanced by the retention of bicarbonate molecules. That is, for every one molecule of hydrogen ion gain, okay, secreted, there is a gain in the gain of the bicarbonate molecule. It means for each molecule hydrogen ion gain, there is intestinal loss of one bicarbonate molecule. Okay, this is well balanced during the health, but during diarrhea, endogenous source of hydrogen ions minimal results, but increase dramatically in state of diarrhea. That means in the situation of acute diarrhea, there is excessive loss of bicarbonate, and there is retention of hydrogen ions. That results in the metabolic acidosis. Okay. But in health, normally, when there is one hydrogen ion is lost, one bicarbonate ion is retained. When the one bicarbonate ion is secreted in the small intestine, okay, one hydrogen ion is bicarbonate ion is secreted in the intestines. One hydrogen ion is secreted into the gastric juice. So it is well balanced. Whereas in case of the diarrhea, there is excessive loss of bicarbonate ions in the intestines. That is not balanced by the degree of secretion of hydrogen ions. And that results in the retention of hydrogen ions, ending up in metabolic acidosis. In children, there is normally 2 to 3 millicalorics of hydrogen ion is produced. At kidney clears nearly 1 to 2 millicalorics per kg per day. Okay. the endogenous hydrogen ions thus released into the plasma are neutralized by the bicarbonate, and there is a decrease of bicarbonate molecules. Because the recurrent release of hydrogen ions during the metabolic activity, they are neutralized by the extracellular bicarbonate. During this process, there is decrease in the level of bicarbonate ions. But kidney, they conserve the bicarbonate ions and secrete the hydrogen ions because lungs cannot generate bicarbonate. Okay, these are the hydrogen ions that are produced regularly during metabolic activity, neutralized by the bicarbonate, because as the lungs cannot generate bicarbonate, it is the kidney that conserves bicarbonate and secretes hydrogen ions, thereby maintaining acid-base balance. Well, thank you very much for patient listening, and we'll meet you again in the next class. Until that time, bye-bye. Hope you have understood the basic terminology of acid-base disturbance with regard to acidosis, alkalosis, again metabolic acidosis and metabolic alkalosis, and the role of kidney and the role of lungs and the buffer systems, the intracellular as well as extracellular compartments that are going to attenuate the changes in the pH, even though there is addition of acid into the body fluids. Okay. With this introduction to the acid-base regulation, we will proceed with the acid-base disturbances in the next class. Thank you very much. We'll see you in the next class. Until that time, bye-bye.